Hello everyone, and I hope the things are going good. People now have made their mindset that yeah, we are going to start the preparation again, or we are going to land up in our dream college. Here comes the first video of 2021, where I'll be dealing with the developmental disturbances in the size of the teeth. The topic is very simple, and I want to share with you that a lot of number of questions have been asked from this topic in the history. I'll be explaining you the topic where we'll be dealing with the size of the teeth as well as your shape of the teeth. The size means it can be small or it can be large, it can be microdontia or it can be macrodontia. And another thing that we'll be sharing is the shape of the teeth, where we'll be dealing whether it's a dilaceration, concrescence, and dense vaginators, dense invaginators, and all that. So let's start with the first topic without taking much of your time. I want you to be clear with this topic. I'll be telling you what kind of questions are asked from this topic and what can be asked from this topic. So here we'll be dealing with the first topic, that is your microdontia, where the size of the teeth will be micro, means the size of the teeth will be smaller than the normal size. The name itself suggests very clearly that the size of the teeth will be small. So three types of microdontia are recognized, that are your true generalized microdontia, or your relative generalized microdontia, or your microdontia involving a single tooth. So true generalized microdontia here itself states that it is truly, the teeth are truly smaller in size, means whatever the size is, normal size of the tooth is, here in true generalized microdontia the teeth are smaller in size. Okay, like you can see in this picture, all the teeth are smaller in size as compared to what is the normal size of the tooth. Whereas in case of relative generalized microdontia, normal or slightly smaller than the normal teeth are present in the jaws that are relatively larger than the normal, means it might appear to be a microdontia, but the size of the jaw is more than normal. That's why even the normal or a little bit of the small tooth are appearing to be very small. So they can give you in a question like which type of microdontia is it, when the jaws are big and the teeth size is relatively normal or smaller than normal. The answer would be a relatively generalized microdontia. Such type of questions are asked, and even directly they can ask you that if the teeth size is smaller than normal, then it is a true generalized microdontia. And next is your microdontia involving a single tooth, means only one tooth is smaller in size, rest all of the tooth are normal in the size. So that single tooth, basically the teeth that are involved whenever there is a microdontia involving a single tooth, that is your lateral incisors or your third molar. So this can be asked, which of the tooth are most commonly involved in your microdontia of a single tooth. It will be your maxillary lateral incisors or third molar, whatever will be given in the option. So this is how the question can be asked. And whenever there is a microdontia involving a single tooth, so that is known as your peg laterals. So they can just directly give you a picture in the exam, that which thing does this picture signify, and you will see that there is a tooth that is only lateral incisor, that is smaller in size, and you can very easily remember that this is your peg laterals. Like you can very easily appreciate here, this is a lateral incisor that is smaller in size, so it is a microdontia involving a single tooth by the name of your peg laterals. So what happens in it, instead of exhibiting the parallel mesial or the distal surfaces, the side converges or taper together incisally. Can you see here, it is tapering together incisally and forming a peg shaped, peg means cone shaped crown. The root of such a tooth is frequently shorter than normal. So clinical based question can be asked like this, that which what does this signify. Answer would be a peg laterals. You can very easily appreciate in the picture. So now these kind of questions can be asked directly. They'll give you a picture and they can ask you, they will not directly ask you what is it known as when only a single tooth is smaller in the size. They can directly give you a picture to appreciate and tell you what it is. Next is your macrodontia. Macrodontia is your true generalized in the same way. Means like microdontia was divided into three types. Macrodontia can also be divided into three types. It can be a true generalized macrodontia, relative generalized macrodontia, or macrodontia of single tooth. So a name itself suggests true generalized macrodontia, which states that all the teeth are larger than normal. Means they are not of the normal size. Generally not much question has been asked on it. And then is relatively generalized microdontia, means the tooth size is relatively normal or slightly larger than the normal, but the jaw size is smaller, so it gives an illusion that the teeth are bigger, so that is known as relative generalized macrodontia. And macrodontia of single tooth is very rarely seen, so this kind of etiology is very less found. And even it can, if it can be found, macrodontia of single tooth, whenever there is a high hemihypertrophy of the face in which the teeth of the involved side, means whenever there is a hemihypertrophy, like two sides of the face are there, if one side of the face is having hypertrophy, then only you will see that one side of the face will have a bigger size of teeth, or even one teeth may be bigger in that. Relatively macrodontia of single tooth is not found, but only in hemihypertrophy the involved side teeth will be of the bigger size. That's it. That is clinically that is found only. So the question that can be asked from this topic is usually like relative generalized macrodontia, that whenever the patient is having a relatively bigger size when the jaw size is less or normal, so what kind of disease it is? It is your relative generalized macrodontia. Or whenever another thing that you should be knowing is the growth hormone. Whenever the growth hormone is increased, so there can be a relatively bigger size of the jaws. So these things you should be knowing, and that's it. Next we come to the shape of the teeth, where we'll be first dealing with your gemination. So gemination, you should be knowing that the gemination teeth are the anomalies which arise from an attempt at the division of the single tooth germ by an invagination, with the resultant incomplete formation of the two teeth. You can see there, this was a single teeth, fine, these are not two teeth, okay, and there was a trial to divide it into two parts. Can you appreciate it here? So it was tried to divide it into two parts, but it was not completely divided. So that is why this is known as gemination, in which anomalies arise from an attempt at the division of the single tooth germ. There was a single tooth germ by an invagilation, with the resultant incomplete formation of the two teeth. So there may appear that these are two teeth, but these are not actually two teeth. ये बस थोड़ी सी they have tried to invaginate the crown only. The root will be one, fine. And it is usually not possible to differentiate between a gemination and a case in which there is a fusion between the normal tooth and a supernumerary tooth. There is usually this thing you are going to face clinically, that whether it is a normal tooth and a supernumerary, some extra tooth that has been fused, or what has happened. So this is what about gemination. The question can be asked that what is it whenever there is an incomplete formation of the two teeth, or they can give you a picture like this, that the number of teeth are normal. What is it? Means these are not 4 teeth, there are 32 teeth present in the mouth. What is it? It's gemination. So you have to use your mind that this is gemination. So you can very beautifully see here in this picture that one teeth has divided into two parts, and the root is common. Can you see that the root is common, and here it has tried to divide into two parts, and this is how the gemination look like. Directly the question can be given in the form of an x-ray, that which type of anomaly you find in this picture. So here it comes, it's a gemination. Clear? Next we come to the fusion. Fusion is something different, fine. Fusion में क्या होगा? It arises through union of two normally separated tooth germs. There was in gemination, there was a one tooth germ that incompletely divided, but here are two tooth germs that are going to fuse. Means two separate teeth are going to fuse, and some physical force or pressure produces the contact of the developing tooth and their subsequent Fusion of teeth is more common in the deciduous tooth. So this question can be asked, that fusion of the teeth is more common in which dentition, whether it is a deciduous dentition or it's a permanent dentition. If this occurs before the calcification, it begins that the two teeth may be completely united to form a single large tooth with a common pulp chamber and the root canal infused pair of the teeth. So if there is no calcification, there can happen that they will have a common root canal and they have a bigger pulp chamber and the teeth are completely fused, means they will appear to be a bigger. The two teeth may completely unite to form a single large tooth. But if it occurs after calcification, then you will see two root canals and two separate teeth like they are joined or fused. Fine. So it depends that it fusion occurs before calcification or after calcification. That can give you a picture of that. So here you can very beautifully appreciate that the fusion occurs after the complete formation of the crown. There will be union of the roots only, and fusion may also occur between a normal tooth and the supernumerary tooth, like I have told you in the gemination. So here the fusion occur after calcification. So these are two separate tooth jumps that are completely united by each other with the two separate root canals and two separate pulp chambers. So the question that is usually asked is, the fusion is found in which type of dentition? It is a deciduous dentition, or they can give you a picture which type of anomaly you find in these two. So you can appreciate that this is a fusion, this is also a fusion. This cannot be gemination because the root canals are separate. This cannot be gemination because they are complete. देख रहे हो आप पूरा नीचे तक there is a division. So it's not an incomplete, means बीच में आके नहीं रुक रहा है. And you can appreciate this is a gemination. Root canal is common and one single tooth has tried to divide itself into two. So let's come to the next anomaly, that is your concrescence. Concrescence, directly the question can be asked that the two teeth are united together by the cementum and the roots are united. Which anomaly is it? Anomaly is concrescence. Concrescence is actually a form of fusion in which occurs after root formation has been completed and teeth are united by the cementum only. You are going to see that two separate crowns are there, means there is no union in the crowns but the roots are united, and that is known as your concrescence. And even the question can be asked that what can be the etiology of the concrescence. It occurs as a result of the traumatic injury or crowding of the teeth with the resorption of the interdental bone, so that the two roots are in contact and become fused by the deposition of the cementum between them. So there is the one root and there is another root. They are attached together by the cementum. The anomaly is concrescence and it can be examined radiographically. So the simple question, what can be the etiology of the concrescence, when the tooth are together united by the cementum, you can remember it like C for concrescence and C for cementum. Very easy to remember. So it is going to be a concrescence, and they can give you a picture like this where you can very beautifully appreciate that they are united together by the cementum. Next comes your dilaceration. So dilaceration refers to the angulation or the sharp bend of curve in the root of the crown of the formed tooth. The tooth is normal but the root is sharp bend. There is a bend in the root. And even the etiology of the concrescence, we have read that it can be a pressure or traumatic injury or crowding of the teeth, which led them, means there would be a pressure from both the sides, or there is a less space in the arc or crowding of the teeth that is letting these things to unite. Next comes your dilaceration. So the etiology can be asked, or the dilaceration is that the curve or bend may occur anywhere along the length of the root, or sometimes at the cervical portion and at other times along the root, or just even at the apex of the root, depending on the amount of the root that is formed whenever the injury has occurred. So there is some injury, there is some pressure, there is some trauma that hits the tooth, and the point at which the root formation is there, means अगर root cervical portion तक बना है it will bend, और अगर वो थोड़ा और नीचे apical portion तक बना है it will bend. So whenever it will bend, it is going to dilacerate the tooth. Okay, dilacerated tooth frequently present difficult problem at the time of the extraction. So what is the clinical significance of the dilaceration? It is that it can provide the problem to the clinician to extract the tooth. That's why whenever we are going to extract a tooth, we just look at the radiograph previously. Even before extracting the third molars, we just take whether it is a dilacerated root or a simple root, so that we can plan out our extraction procedure according to that that. So the clinical significance of the dilaceration is that it can present difficult problems at the time of the extraction, so it is very necessary to look at the radiograph before extracting a dilacerated tooth. So you can again appreciate here radiographically, this is a simple root that has been angulated. Clear? Done? Next we come to the talon cusp, and talon cusp, again a lot of number of questions are asked from the talon cusp, and I have shown you the clinical picture. This is a talon cusp. Directly the question can be asked that which anomaly is it. It is a talon cusp, and you are going to find these anomalies clinically also. It is an anomalous structure resembling an eagle's tunnel that projects lingually from the cingulum areas of the maxillary or mandibular permanent incisor. So these are basically found in your permanent incisor and appears to be more prevalent in your Robinson-Tybee syndrome. So the question can be asked that the talon's cusp is found in which syndrome. The answer would be your Robinson-Tybee syndrome, and the question directly can be asked that which anomaly is it. Answer is your talon's cusp, and because it resembles an eagle's talon, that's why even the question can be asked why is it called as talon's cusp, because it resembles the eagle's talon, and that's why it is a talon's cusp. Most commonly found on your maxillary or mandibular permanent incisor. That's it guys, nothing much to remember in this talon's cusp. Very important that it is found in your Robinson-Tybee syndrome. Direct the question can be asked. A lot number of times question has been asked, the talon's cusp is found in which syndrome. Next is your dens indente. So the name itself suggests indente means inside. Okay, so directly I have made it bold that whenever it represents a tooth within a tooth, so what anomaly is it? It is dens indente. So let me read about that. It is a developmental variation that is thought to arise as a result of invagination in the surface of the tooth crown before it is calcified. So before it is calcified, there is an invagination, and maxillary permanent lateral incisors are the teeth that are most frequently involved in the dens indente. And it seems to be a accentuation of the lingual pit, and radiographically we can see a pear-shaped invagination of the enamel and the dentine with the narrow constriction at the opening surface of the tooth. So the question can be asked pear-shaped invagination, it is dens indente. I'll be showing you the picture. And tooth within a tooth, it is dens indente, and it occurs before the calcification has occurred, means the tooth is not completely calcified. Yes, this anomaly does happen, and the another name of this is going to be your dens invaginatus or dilated composite odontome. So invaginatus because it is inside, something that is going inside the tooth. Suppose this is a tooth, and again something has invaginated inside the tooth, it appears that there is a tooth within a tooth. That is why it is known as tooth within a tooth or dens indente or dens invaginatus. So you can very easily appreciate from this diagram, like there is an invagination inside the tooth like this. You can see here is thoda sa आगे तक and here is और आगे तक और नीचे तक. So three type of dens indente can be appreciated. Dens invaginatus भी बोलते हैं, and there may appear that there is a tooth within a tooth, because like you can see that there is a again जैसे enamel है, there is an enamel or pulp again inside the tooth, so there appears to be a tooth within the tooth, and this is how you should be knowing. Next is dens invaginatus. Invaginatus is something inside, evaginatus is something outside. Dens invaginatus is a developmental condition that appears clinically an accessory cusp or a globule of the enamel on the occlusal surface between the buccal and the lingual cusp of your premolar. So you can appreciate this. I'm putting it dot here. So this is a dens invaginatus, most commonly found on the premolar between the buccal and the lingual cusp of the premolar, and you can appreciate it here. And the pathogenesis of the lesion is thought to be proliferation or an evagination of an area of inner enamel epithelium and subadjacent mesenchyme into the dental organ during the, means whenever there is a proliferation of the dental organ, so that is dens invaginatus, and most commonly found in your premolars. That's it, nothing much can be it. They can give you a picture clinically which anomaly is it. You can see that it's a premolar, something outside, it's dens invaginatus. Next anomaly that we come across is your taurodontism, and taurodontism, very important, a lot number of questions are asked in it, and it describes a peculiar anomaly in which body of the tooth is enlarged at the expense of the roots, means the body is enlarged, means at the expense of the roots. Roots can be small. Fine. So the body is enlarged at the expense of the roots, and they can ask you, what do you mean by bull teeth? Bull teeth is your taurodontism, and it can be classified as hypotaurodontism, mesotaurodontism, or hypertaurodontism. Means it can be a small big teeth, medium big teeth, or a very big teeth. It is believed that whenever Hertwig's epithelial root sheath is not able to invaginate, suppose this is the Hertwig's epithelial root sheath, wherever it invaginates, it forms a cemento-enamel junction, and whenever it is not able to invaginate at its proper level, means it is going to invaginate more down, so the tooth portion will be bigger. So the reason that is failure of the Hertwig's epithelial root sheath to invaginate at the proper horizontal level, a very important question that can be asked in it. So here we will come to know that taurodontism is by the failure of the Hertwig's epithelial root sheath to invaginate at a proper horizontal level. Another question that can be asked is that this taurodontism is found more common with the Klinefelter syndrome. So Talon's cusp is with Robinson-Tybee syndrome, and taurodontism with the Klinefelter syndrome. Very important point. Radiographically, in this taurodontism, the pulp chambers are extremely large with a much greater apico-occlusal height than the normal. So, if the pulp chamber is this much in normal teeth, here it will be this much. The width will be increased and the height will also be increased. I'll be showing you in the picture in the coming slide. And in addition, the pulp lacks the usual constriction at the cervical of the tooth, and roots are also extremely short. So this is also an important point to understand. So here you can see that you can very well appreciate the taurodontism, increased apico-occlusal height with apically positioned pulpal floor and the bifurcation. You can very well appreciate here. Here is the bifurcation. So the height is increased. So they can give you a question like which anomaly is this, and you have to understand that it's taurodontism. So it's a normal tooth, you can very well appreciate here, and it is a mild hypotaurodont. Means taurodont means it's a bigger, but it's less bigger. You can appreciate here, this much is the height, and this is moderate mesotaurodont. Okay, a little bit more bigger pulp chamber and smaller roots, and this is severe hypertaurodont, bigger pulp chamber with the smaller roots. Fine. So this is how the question on taurodontism are asked, that other name of the bull teeth, it's your taurodontism. And what is the reason for taurodontism? That Hertwig's epithelial root sheath is not able to invaginate at the proper level. And another question that can be asked is that in which syndrome is it found? And another question that can be asked is examine which anomaly is this, and some of the severe types of taurodontism here you can appreciate. So that's it for today. I hope I made the topic clear as well as easier for all of you. We are starting with our batches, and I'll be giving the link in the description box for our WhatsApp group as well as for our Telegram group. For the demo purpose, you can also join the groups and directly join the groups, as well as you can for more information contact us at 76578 78060. Fine, bye bye.